Depressive Disorders, from Brian Levy, Dennis, Julia, Viola, Gianna Novello, and Canella Caruso will be presenting Depressive Disorders. Our overview will be as follows: an introduction, forms of depression, background, characteristics and symptoms, causes, treatments of intervention, results of research evaluating the effectiveness of treatment, the media portrayal, as well as the conclusion. Introduction. Depression is commonly confused in today's society. It is the most common mental disorder that affects most people. It affects each person quite differently. It can affect their life, their work schedule, their sleeping habits, and their eating habits. Most people are not clear on what makes depression different than feeling sad. Depression is a continuous feeling of sadness that affects the body, mind, and thought process. These people have no desire to socialize and enjoy other people's company or enjoy the activities they used to do. People with a depressive illness have a different time to come through these sad feelings. It's hard for them to put themselves back together. People suffering with this illness require medical treatment in order to get better and feel better faster. Without treatment, people with this illness can have symptoms that may last from weeks to years. Who is affected? Mental illness can directly or indirectly affect all Canadians through family or friends. 20% of Canadians will personally experience a mental illness in their lifetime. Mental illness affects people of all ages. Doesn't matter of their education levels, regardless of how much money they make, and doesn't matter on their culture. Approximately 8% of adults will experience major depression at some point in their lives. About 1% of Canadians will experience bipolar or manic depression. Forms of depression. Persistent depressive disorder is also called dysmethia, is a depressed mood that lasts for as long as 2 years. A person diagnosed with persistent depressive disorder may have some episodes of major depression along with periods of less severe symptoms. To have persistent depression disorder, the symptoms continue for 2 years. Prenatal depression is a lot different than having baby blues. It's a full-blown major depression during pregnancy or after delivery called postpartum depression. These feelings of sadness, anxiety, and exhaustion accompany prenatal depression, making it difficult for these new mothers to take care of themselves and the babies. Psychotic depression occurs when a person has severe depression plus some form of psychosis, such as delusions or hallucinations, where they see and hear things. Seasonal affective disorder is characterized by the onset of depression during the winter months, where there is less sunlight. This depression usually subsides during spring and summer. Winter depression typically is from social withdrawal, increased sleep, and weight gain, and returns every year in the winter. Bipolar disorder is different from depression. They experience episodes of high and low moods, also called mania or hypomania. There are other examples that have been newly added to the DSM-5, which include disruptive mood dysregulation order, which is a diagnosis in children and adolescents, and premenstrual dysphoric disorder.
Depression is not just a change in mood. It is a medical condition which affects the emotional, physical, behavioral, and cognitive levels of an individual. Someone who is dealing with depression deals with feelings of extreme despair over a long period of time. Almost all aspects of a person's life will be affected by depression. It can affect their emotions, relationships with family and friends, as well as affect their work life. It is estimated that approximately 121 million people worldwide suffer from depression. People who suffer from depression can also increase their risk in developing obesity, heart disease, stroke, sleep disorders, and lack of education. Individuals that are most likely to suffer from depression include those who are unemployed as well as those recently divorced. Depression is most prevalent in people ages 45 to 64. and approximately 80% of all individuals diagnosed with depression will not seek any form of treatment. The number of individuals diagnosed with depression continues to increase approximately 20% each year.
Characteristics and symptoms. Everyone has changes in their mood and fluctuations in their feelings. People experience highs and lows. However, depression is different and it's more intense. Symptoms of depression include feelings of sadness, worthlessness, and hopelessness, as well as general anxiety. Signs also include general loss of interest in things they once enjoyed. Now they have no interest and may withdraw from others or isolate themselves. Depression also affects concentration and increases difficulty in doing once easy tasks, such as focusing, retaining, and remembering information, and even decision-making skills can become impaired. Depression is an overall change. It can change the way people eat and sleep and may even experience co-occurring health problems. For example, changes in feeling. The person may feel sad or like they have a low self-esteem, so their thinking changes. They feel like they're not good enough, and these feelings occupy their mind constantly. Then there are changes in their physical health. A lot of people experience headaches or nausea when they are depressed, and their behavior is affected and changes. So they may increase the amount of sleeping, or they do not want to go out and socialize. It can be difficult to recognize signs or symptoms of depression in young adults, and more specifically in teenagers, as they're going through many emotional changes and experience moody tendencies naturally. It is increasingly difficult for parents to differentiate between what is considered normal and what may be depressive behavior. Additionally, males express or experience more anger or irritability opposed to general sadness, which again makes depression harder for others to identify. A key identifier or characteristic of depression is the duration. Typically, if the sadness or low self-esteem and mood lasts for 2 weeks or more, it is considered depression. Causes. The exact cause of depression is unknown. However, there are risk factors that can increase the chance of depression if one or more factors present. One theory of etiology of depression stems from a biological or genetic predisposition, in which there's a chemical imbalance in the brain of serotonin and norepinephrine, which are neurotransmitters, which are found in the brain. Psychological factors refer to a person's thought process as well as coping skills. Each person's own thoughts dictate how they will experience their life. Some people think more positively, and some people think more negatively. The way people think about things and view the world typically is established when they're young or during childhood. An example of this is if someone were raised in a very strict upbringing and were constantly criticized, naturally their view on certain things in life will now be more negative. And already having a negative foundation causes a predisposition to negative thoughts. In addition, if the coping skills are hindered, it makes it even more challenging to stay positive during difficult situations. Additionally, one's environment can cause or trigger depression. A stressful work environment, demanding schedules, as well as social isolation can cause depression. Additionally, a traumatic event such as death of a loved one or divorce can act as a catalyst to depression. Some people experience one of these factors, and some people experience a combination of the factors, and they can be intertwined. So any changes in life or situations that may be negative, increase negative thoughts, which can, for example, decrease sleep, and which causes social withdrawal or decline in self-care, which can further hinder emotions or self-esteem and outlook, and even alter people's physical state of well-being.
Treatment or intervention. Youth workers, helpline volunteers, clinical workers, and individuals experiencing the symptoms all have many different ways to treat and manage depression. Pharmacotherapy, medical treatment by the use of drugs. Psychotherapy is the treatment of mental issues using psychological means rather than medical. During psychotherapy, a person with depression talks to a licensed and trained mental health care professional who helps him or her identify and work through the factors that may be causing their depression. Psychotherapy and pharmacotherapy may be used in succession as a combination of both therapies, which may be used alone. Physical activity intervention is the use of exercise as a form of depression management. However, the amount of evidence supporting this as an effective intervention is very little compared to the other interventions. Mindfulness-based therapy, or MBT, is an intervention that encourages a non-judgmental and moment-by-moment awareness. Treatment could include having someone focus on their body sensations or on the physical world around them, or accepting one's thoughts as something that can be viewed objectively. Overall, the current research on depression intervention and treatment is still full of contradictions and conflicting evidence. Among the current studies of depression interventions and treatments, it is unclear as to whether targeted interventions, for example, those that target at-risk young people, are more effective than universal interventions, so those that target the general population, or whether both are equally effective. Furthermore, it is unclear as to whether shorter interventions are more effective than longer interventions, or whether there is no difference between the two. Results of research evaluating the effectiveness of treatment. One study that examined the effectiveness of using physical activity as a treatment for depression is titled Prospective Study of Cardiorespiratory Fitness and Depressive Symptoms in Women and Men. Cardiorespiratory fitness, also known as CRF, is an objective measurement of how well the heart, the lungs, and the muscles work together to keep the body active over an extended period of time. The purpose of the study was to follow individuals over time to examine whether those with higher levels of CRF have a lower risk of developing depressive symptoms. 11,258 men and 3,085 women enrolled in the study and completed a maximal treadmill exercise test and a follow-up health survey. The prospective study was done between 1970 to 1995 with an average of about 12 years of follow-up. CRF was measured as the length of time individuals ran for. The participants were categorized into age and sex stratified groups, as the lowest 20% times being classified as the low group, the middle 40% times as the moderate group, and the high group as being the highest 40% times. Depressive symptoms were assessed using the 20-item Center for Epidemiologic Studies Depression Scale, also known as CESD. Those who scored 16 or more on the CESD were considered to have depressive symptoms. After the follow-up, 282 women and 740 men reported depressive symptoms. After adjusting for age, baseline examination year, and survey response year, the odds of reporting depressive symptoms were 31% lower for men with moderate CRF and 51% lower for men with high CRF compared to men with low CRF. When comparing to women with low CRF, the odds of reporting depressive symptoms were 40% lower for women with moderate CRF and 54% lower for women with high CRF. This study supports that physical activity has an inverse association with the risk of developing elevated depressive symptoms. The use of the maximal treadmill exercise test is a major strength in this study because it can accurately quantify the CRF of participants, rather than assessing for physical activity using a questionnaire. The large number of person years of follow-up enabled the researchers to investigate a dose-response relationship in both men and women. A major limitation in the study was that although some participants were classified as having depressive symptoms, it did not mean that they were clinically diagnosed with depression. The use of a questionnaire to assess for depressive symptoms is not as accurate as having a medical doctor diagnose the patients. The clear dose-response relationship between physical activity and depressive symptoms, as found in this study, should encourage individuals to lead a physical, healthy lifestyle. Doing so may not only reduce cardiovascular disease, but also the risk of depression. These findings are also useful to healthcare professionals as they can advise their patients with depression about the benefits of physical activity for mental health well-being.
This commercial is one of a few created by Depression Hurts in order to stop the stigma against mental health, specifically depression. This video goes on to describe and show an individual's life suffering with depression and how it affects themselves, their work life, and family relationships. I think this video is a good depiction of what depression is like and how it affects those around you. It displays a young woman not wanting to get out of bed, a gentleman who does not want to eat, a woman not wanting to play with her children, and it also shows a man not wanting to walk or play with his dog. In this short video, it has depicted a lot of the signs and symptoms of someone who is depressed. Loss of interest in activities, loss of appetite, and affecting the relationships with family. This video also tries to incorporate showing that depression not only affects us emotionally, but that it will and can affect people physically as well. I think this video does a good job of trying to put away the stigma and tries to educate people about depression and how it affects everyone. With videos like this, along with many other mental health awareness campaigns, we can maybe stop the stigma against mental health and work together in order to help those in need. Depression can affect anyone and everyone. It is important to know how to help someone dealing with depression and look for the signs and symptoms which may not always be obvious in order to be there for that person.
Where does depression hurt? Everywhere. Who does depression hurt? Everyone. How does depression hurt? You know you can feel it emotionally, but did you know that you can also feel depression physically? Go to depressionhurts.com and learn what the symptoms are. There are treatments that work on both the emotional and painful physical symptoms of depression. At depressionhurts.com, you'll find a simple checklist of symptoms. Compare it to what you're feeling. Then tell your doctor what you're feeling. Depression hurts, but you don't have to.
In conclusion, we know that depression will affect all Canadians at one point in their life. Depression will and can affect everyone at one point in their life. Although some episodes may be brief, this is a serious illness that is most common and people should not be afraid to get help. If you think you have some form of depression or know someone suffering from depression, please advise them or yourself to get professional help. People with depression also have fluctuated serotonin levels when they're going through a sad time or a rough time in their life. If the serotonin level does not return back to normal, they must seek help. There is no need in hiding or being ashamed. It can be easily treated. New treatment can be short-term with positive effects. Your community mental health professionals like psychiatrists, psychologists, social workers, and those at your community healthcare facility are ready to help you. Why should you suffer any longer when you should? There is help out there for you. Thank you.